Hello, my name is Larry Reynolds. The date is October 23rd, 2019. This is my very first presentation in module or week 2. We're going to present on information learned from last week in module 1. I have my handy dandy reference tool. Let me get it centered there. It just has a list of the 11 topics that I'm going to cover over the next 5 or so minutes. So without further ado, the first topic is disease definition. So a disease is a disorder of the body or parts of the body that can be acquired over time, or it can be during one's lifetime, or it can be hereditary. An example of a disease would be acute cholecystitis, so acute inflammation of the gallbladder. Disease classification is the next one. So the classification of diseases, we use an international standard called the ICD catalog. It stands for International Classification of Diseases. It is a alphanumeric cataloging system where a specific alphanumeric value is associated with a known disease. So for example, hypertension, for example, is the ICD code for hypertension is I10, I10. Next on the list, we have etiology. Etiology is the cause of a known disease or disease pattern. So the etiology, let's say, for example, viral hepatitis. So hepatitis A, Hep B, Hep C. The known etiology of viral hepatitis would be a viral infection or viral exposure to the particular viral agent that affects the liver. Next term we have pathogenesis. Pathogenesis refers to the beginning and progression or course of a disease or disorder. So for example, let's say on day 1 you have you wake up. So the pathogenesis, the disease progression of a standard run-of-the-mill normal viral infection would be, say, day 1 you wake up, you have signs and symptoms of fever, chills, nausea, vomiting, diarrhea, and you just feel overall crummy, fatigue, and you have a dry, non-productive cough. You feel it's a viral infection, so there's really nothing to do except for wait it out, since antibiotics don't work on viruses. So you do what you're supposed to do. Just take it easy for a few days, drink plenty of fluids. Let's say day 3 rolls around, your symptoms are getting better, but they're still there. So you still have a mild fever that comes and goes. You're no longer nauseous. No diarrhea is gone. And you still have a cough, but it's no longer dry, it's now wet, but it's also doing a little bit better as well. So let's say you do the same thing, take it easy for a few days. Day 5 rolls around and you wake up in the morning and you feel like $1,000,000, you're back to your normal self. That would be the pathogenesis of the common cold, or a common viral infection or stomach bug. So what's next? We have symptoms. So symptoms are clinical manifestations of a disease. They are not the same thing as signs, which we'll get to in a minute, but symptoms are subjective to the patient, reported by the patient. They are not really quantifiable or measurable. And examples of that would be, the list goes on. Let's say abdominal pain, like feeling flush, feeling feverish, things of that nature. So that leads us into signs. Signs are it's the flip side, the flip side of that coin, of the same coin from symptoms. Signs, on the other hand, are objective, clinically objective, observable, and measurable, quantifiable generally. So an example of a sign, there are many out there. Let's say a palpated heart rate, or let's say the patient's in the hospital and on the cardiac monitor, you have a numerical value derived from your pulse check or your monitor of a heart rate of 84. Same thing, you measure a temperature with a thermometer, it comes out to be 38.4 degrees Celsius, which of course is a fever. But these are measurable and quantifiable and observable. And objective. Next, we have syndrome. Syndrome is it's a collection of signs and symptoms that are generally associated with a known disease or disease pattern. For example, we have toxic shock syndrome, or rather, let's say septic shock syndrome. The disease that it's associated with would be sepsis, an acute infection of one's bloodstream, and the body's response to that, the clinical manifestations would be widespread generally, and dramatic generally. But let's say signs and symptoms would include a dramatic drop, or at least widening of the blood pressure, a dramatic and profound spike in one's heart rate, a high fever usually, elevated white blood cells. The patient could be cool, clammy. They could even be have altered mentation, altered mental status, obtunded, confused, things like that. So that is syndrome. Diagnosis is the designation or identification of a known disease based on what we see from the patient. So clinical manifestations, signs, symptoms. It's derived from those signs and symptoms observed and reported by the patient, as well as your own physical exam and assessment, the patient's own medical history, the patient's family medical history, diagnostic tools and diagnostic tests run and evaluated. These are all the methodologies and the tools that we use to reach a diagnosis of a suspected disease. What's next? Complications. Complications is a term that we use to provide a negative impact, or a negative secondary problematic event that's caused by a disease or a treatment of a disease sometimes. So for example, a complication of let's say chronically poorly controlled diabetes, so high blood sugar for a long time. A complication of that, oftentimes we see is chronic kidney disease. If you go even further than that, a complication of that could be end-stage renal disease, where the kidneys don't work at all and the patient is dependent on 3-day-a-week hemodialysis, and even further than that, a further complication from that could be congestive heart failure from chronic fluid buildup and strain on the heart from all the excess fluid. The complications arise from just about anything. I'm running out of time. Let me speed through this. The next to last we have is prognosis. Prognosis is a term that we used to describe the probable course of a disease or disorder. It helps us describe the patient's mortality, life expectancy, and how the disease actually will affect the patient in their daily life. So their ability to perform activities of daily living, and like I said, they're in many times, in many cases, can affect their mortality and their life expectancy as well. So an example of this would be, let's say you have a new cancer patient, a patient with a brand new diagnosis of stage 4 metastatic brain cancer. The prognosis is quite poor, obviously, for that patient. We would expect to see a very rapid decline and deterioration of their ability to perform their activities of daily living, and their quality of life. We would expect that to decline rather quickly, especially by the time we get that diagnosis. And then, of course, their mortality would dramatically decrease as well. We would expect them probably to live 6 months to a year, something like that, if that. Their mortality and their prognosis is quite poor. Diagnostic tests is our last one, and like I said, I'm way over, so I'm hoping to get done with this very quickly. So diagnostic test is our last one, and the diagnostic test is basically any clinical or procedural or medical tool or methodology that we use to build towards or identify a known disease or suspected disease, or even rule out a disease in some cases. But an example of that, they're endless, but most commonly lab work, so blood work, urine tests, radiology studies, and even more invasive, more highly invasive types of studies. So let's say a traumatic penetration of the abdomen, where you're not sure exactly where the injuries are. You know the patient's bleeding somewhere. A lot of times the trauma surgeons will just go in for an exploratory laparotomy, and they'll make a midline incision in the abdomen, open up the abdomen, and just go in with their hands and their eyes and observe what actually is the cause of this disease, or this disorder, this traumatic mechanism. So they'll go in, hopefully find the problem, fix it, and then that would be their diagnostic tool or diagnostic test. That's all I have. That's the 11 items that I had that I had on my list to go over. I hope you enjoyed it. I know I'm way over time. I hope that's okay, and I hope you learned something. Thank you for listening. This is me signing off. Have a great day.